Hi, I'm Paul Trammell and I'm in Human Resources for Dialysis Clinic Inc. Thank you so much for visiting our career site and your interest in learning more about DCI. So if you're visiting our career page, I can only assume that you're looking at potential job opportunities with our organization. That's fantastic. We've recently upgraded our career page so you can easily see what we have available in the 30 states that we serve and can easily apply with just a few clicks. But while we're looking around, let me ask you a couple of questions. What are you looking for in your next career move? Are you looking for just another job, or are you looking for something that's more meaningful? We know there's a lot of healthcare job opportunities out there right now, as well as a lot of uncertainties that have surfaced over the last couple of years that may be influencing your job search. Perhaps you're a new nurse grad looking for your first career opportunity as an RN, or perhaps you're an experienced nurse just looking for a fresh start. Maybe you're a talented patient care technician, a social worker, or a registered dietitian looking for something different. In any of these cases, you're welcome here and you're encouraged to apply if you're looking for something more than just another job in healthcare. DCI has a lot of good people here doing the right things the right way when it comes to delivering high quality care to the patients that we serve. It's important to know that we are a nonprofit service organization where the care of our patient is the entire reason for our existence. To us, it's not about how big we are or how large our annual earnings are each year. It's more about providing high-quality, comprehensive care to patients with chronic kidney disease. Primarily, DCI is a dialysis provider for patients with end-stage renal disease. Today, we care for nearly 15,000 patients in more than 260 clinics, as well as provide acute dialysis services in more than 100 hospitals. We also have great home therapy programs so some of our patients can have treatments in the comfort of their own home. But we do more than just dialysis. DCI dedicates a significant portion of our resources to kidney transplantation for our patients. We have a separate nonprofit corporation called DCI Donor Services that's become one of the largest organ and tissue recovery programs in the nation. We also have a great kidney health management program called REACH. This program is designed to prevent or slow down the progression of kidney disease to decrease the number of patients requiring dialysis care. We also host a summer camp called Camp Okawina here in Nashville for pediatric patients across the country who've been transplanted or receiving dialysis treatments. Our patients aren't just numbers, they're individuals, and our mission, vision, and values are all focused on giving each one of our patients the best possible kidney care we can give them. That's what makes DCI different and unique. We get to know our patients on a personal level. Sure, we're here to help them with their physical needs, but we're also here to understand what they're dealing with on an emotional, spiritual, and social level. DCI has clinics in major markets and cities, but we also invest in underserved areas for patients who need better access to kidney care. We serve all of our patients, our employees, and our communities with genuine care and courtesy. And I can tell you firsthand, there's a very real culture here of treating everyone with kindness and respect.
So my path has been with DCI, starting out as an LPN, clinical floor nurse. I moved on into the charge nurse role as an RN and eventually became a nurse manager for DCI, and now I'm working at the DCI corporate level as a corporate nurse consultant. I've enjoyed my journey. I've had experiences, clinical experiences that surpass anything I could have ever imagined, and also the development professionally as a nurse that I've learned here with my family at DCI.
Perfect for me was how I've been treated, right? Not only as an individual, so I've been a reuse technician, I've been a patient care technician, I've been an equipment technician, all in the local clinics, and then in the corporate office, I've been a corporate technical consultant. My current role now is the Associate Director of Quality and Education. But at every one of those levels, my supervisor was always rooting for me, was always challenging me to be better, was always encouraging me to be better. What we as a company are willing to do for the employee to make sure that the employee has a good quality of work and a good quality of life. I think that's what makes it important. And I think DCI is really a champion of their employees.
I love working at DCI. I started at DCI in 2003 in Pittsburgh, and I worked there for 7 years, and then I left DCI. However, I came back to DCI, obviously, because DCI was a better company to work for, and I'm happy here, and I love working at DCI.
Over the last 25 years, the biggest thing I learned from DCI is that if you're looking for an opportunity, you're going to have it here. And if you want to work in a family style run company, this is it. When I first came to DCI, I was told those two things, and I'm like, oh yeah, we'll see. 25 years later, yes, they were right. That is correct.
DCI was my first job straight out of graduate school. To be honest with you, what brought me here was just simple, there was an ad in the paper. But it's really more about what's kept me here. I've grown up at DCI. I'll be here 27 years in just a couple of months. So when I say I've grown up here, I have literally grown up at DCI. And I wouldn't want to work anywhere else. DCI has the patient's best interest at heart, the employee's best interest at heart. DCI is just a fantastic place to work. And I'll tell anybody that.
So if you're looking for something different or more meaningful in your next job, we encourage you to join us here at DCI. Our objective is to find skilled and compassionate employees who are committed to providing this kind of high-quality patient care. We offer competitive pay, outstanding benefits, and a great working environment. If I can help you in any way, please contact me directly. I can be reached at paul.trammell@dciinc.org, or you can phone me at 615-342-0397. Thank you for visiting our career page and considering employment with DCI. I hope to see you here soon.